Thank you. Thank you very much. And I just want to thank Farley Center, Williamsburg Place, for having these workshops. And isn't this a beautiful campus? It's beautiful. So I'm originally from Hampton, Virginia, now live in Yorktown, and I'm the founder of Genesis Counseling Center. We have several campuses. Our largest site is in Hampton, Virginia, and that's where we started. And then our second largest is here in Williamsburg. I work out of those two sites, really in terms of my clinical work, just doing assessment. I am a psychologist, and one of my specialties is autism assessment. But at Genesis, we have Genesis Assessment Services for assessing really a wide range of issues, ADHD, best practice ADHD assessments, autism assessments, neuropsychological assessments, including looking at dementia with Wechsler memory scales and other batteries. So remember us for that. We do assessment out of actually Williamsburg, Hampton, and Chesapeake locations. And what we do mostly, though, at Genesis Counseling Center is therapy. We have over 40 wonderful licensed therapists that specialize really from the youngest, probably age 3. Our play therapist takes 3 years old and up, to geriatric. And actually, our specialist for seniors is here in our Williamsburg location, Lorraine DiMuccio. We also provide EMDR. One of our EMDR specialists is here, Dana Lyon, LPC, with us. And a couple other locations of Genesis, Yorktown, also at Lackey Free Clinic. We provide some free therapy there, keep that in mind. And over at Point Harbor in Chesapeake, as well as Harborview, a new site there. So that's Genesis, and many years ago, we decided to really invest in best practice assessment for autism because there was a lack of that in the area. Now, I know of several agencies that might provide ADOS assessment. We're going to be talking about the ADOS, which is the Autistic Diagnostic Observation Schedule. You'll get a lot of details about that in our second hour and how that's the anchor to a battery of tests that we give children and adults on spectrum. So regarding autism, I want to start by reading a quote from Tony Atwood. Some of you, I'm sure, are familiar with his work. He's done quite a bit of research and writing in the area of Asperger's and also autism spectrum. And he says, and he's speaking primarily of Asperger's syndrome, but this could relate to everyone on the spectrum. He says, they are a bright thread in the rich tapestry of life, autism spectrum individuals. Our civilization would be extremely dull and sterile if we did not have and treasure people with Asperger's syndrome. So while this does fall under autism spectrum disorder as a disorder, I do see the giftedness of the brain that is neuroatypical. And I'm sure you all have as well, for those of you who have worked with these fascinating individuals who are on the spectrum, autism spectrum. I want to get a feel of who's in the room, where everyone's from. Like I said, I'm originally from Hampton, Virginia. I also had the privilege of working here in Williamsburg. My first job out of my bachelor's degree in psychology was at Eastern State Hospital. And I was hooked. I love this field. Do we have anyone who's ever been associated with Eastern State Hospital in any way here? Show of hands. Yeah. Oldest psych hospital in America, dates back to 1773. For those of you who haven't seen the original building, well, it's not the original, but where the original building was, in CW, Colonial Williamsburg, take a look at the public hospital. It's pretty amazing. And so how about Colonial Behavioral Health? Yes, yeah, welcome. Thanks for everything you guys do. And see.
I did my internship in a mental hospital like that in New York, and we, autism back then, a long time ago, we just let them be. We just watched watched them, and I thought they were amazing, but I thought they were kind of happy in your world.
You said
I
happy?
thought that they were happy, in the situation that they were in. They were happy little kids.
Well, and we'll say with Asperger's and autism spectrum disorder, if you know one person on spectrum, you know one person on spectrum. So some are, and yet sometimes we will see those that have not been accurately diagnosed perhaps, or had an assessment, and then depression, anxiety can emerge, particularly in those middle school, high school ages. Yeah. Well, other agencies, those in private practice? Yes. Great. And Hampton Newport News CSB or Gloucester CSB? All right, good. Thanks for making the drive. Wonderful. How about the school system? Yeah, Dr. Lee is here. Yes. Great. With York County Schools. All right. VA? All right. Great. Navy? All right. Anyone else? Richmond? Thank you for coming. Yeah. EAP? All right. Wonderful. And from here, Pavilion, Farley Center. Yes. Great. All right. Thank you. And right before the break and at the end, particularly at the end, I would like to share resources. Dr. Lee hosts a Asperger's support group once a month. That's free. So we'll be talking about that and sharing resources at the end. But do we have any ABA therapists, applied behavioral analysis? No, we have a shortage of ABA therapists. We're referring quite a bit. But I will talk at the end about where to find ABA therapists in our community. Okay, so autism. Here are learning objectives, and I think you guys can follow along in your notes. We're going to learn and be able to articulate about all 3 levels of autism, as well as understanding assessments. I'll talk about more than just the ADOS, but the ADOS-2 is the gold standard assessment for autism across the lifespan. And then, of course, resources and treatments. So autism is the fastest growing developmental disability in the U.S., 1 in 64 children, according to the CDC, and that was in 2016. And then 1 in 20 children are thought to have sensory processing issues. Now, sensory processing disorder is not in the DSM, but it's closely linked with autism. And we have a wonderful blog on sensory processing disorder from our therapist, Megan Walkley, who sees children here in our Williamsburg practice. Sensory processing disorder particularly is when they're very sensitive to things in the environment, such as texture, sounds, noises, tags in clothing, or other tactile touch, balance, and sights. So I do want to tell a little more about the prevalence of autism in the U.S. It has increased by 119% from 2000 to 2010. It's the fastest growing developmental disability, as we see there, and the prevalence increased by 6 to 15% each year from 2002 to 2010. So why is it increasing? There's several theories about that. It's occurring more, perhaps there are theories out there about maybe because of additives, preservatives in foods. There's the vaccination theory. It is just a theory. There's if you're interested in understanding more about that, there's a 7-part series on YouTube called The Truth About Vaccines. And we can't say that vaccines cause autism, but some parents that I've met with, and I'm sure you all have met with, say things changed for my child after vaccines. Then, of course, we have better assessment now, so maybe that's why there's been an increase. The ADOS-2 has not been around that long. So really in the last 10 years, we've been able to have better assessment. So some of the children, when I was working 20 years ago at Virginia Beach Psych as the child and case manager there, some of the children that may have been diagnosed with pervasive developmental delay, which was kind of a catch-all, or perhaps bipolar disorder or ADHD, but it didn't quite fit. I'm wondering now, if they would be diagnosed with autism. So better assessment might be part of the reason the prevalence of autism is on the rise. And then the recategorization in the DSM-5 that includes several diagnoses under the autism spectrum disorder umbrella. So, of course, Asperger's being placed under that umbrella, and childhood disintegrative disorder, as well as, and what we did know is sensory processing disorder. Sometimes those kids fit under the umbrella. I want to quote from Leanne Willie's book about Asperger's now being under the umbrella of autism spectrum disorder, because as you all know, there's been some controversy over that. Leanne, if you don't know of her, Leanne Willie, she wrote Pretending to be Normal. She is on the spectrum. She has Asperger's. And she writes, the ASD, autism spectrum disorder community, is a tight one, and maybe more so now that the DSM-5 made some very substantial and divisive changes that try to make an Asperger's syndrome diagnosis nothing more than a memory erased. She says, fat chance of that. People with Asperger's are tenacious and routine-oriented. We can't be erased or easily moved to another term. And as we know, transition can be difficult for people with Asperger's. So now I believe we are stronger than ever before and more determined to prove we are fantastic individuals filled with admirable traits and loads of potential. I just wanted to read that from the perspective of someone who is Asperger's and has lived with this all of her life. So, I want to show you what it might be like for a child that is struggling on the autism spectrum. And brief video here.
Six, 7, 8, 9.
Take my hand.
I'm not naughty. I'm autistic. And I just get too much information.
Okay, so you can see there what it's like for this young man, this boy, who has autism and gets overstimulated with the noises, the sounds. So see how that's also a sensory processing issue for him. And yet he was trying to learn, or to practice his coping skill of counting. That's one thing we teach, and yet it was still too stimulated. All right, so autism. Basically, all three levels of autism, here are two key signs that we look for before diagnosing. One is difficulties in social interactions, also maybe emotional expressions, and then secondly, the restricted repetitive behaviors or interest. And it's important that there be a restricted interest, or we don't diagnose autism. We might diagnose, say, social communication disorder or social anxiety if it's just issues with socialization. And autism may or may not include issues with cognitive functioning. Some individuals on spectrum may also have ID, intellectual disability, but many do not. And as we know, particularly with high-functioning autistic individuals, the level 1 Asperger's folks, typically their intelligence is average to above average or superior. Also, language impairment. Usually, I would say with a lot of cases of autism, early on there might be a speech delay or speech issue. Many individuals with Asperger's and autism might have speech therapy early on, and early intervention takes care of that. But then there are many people on spectrum that language is not a problem. Speech is not a problem. But you definitely want to assess for those two issues, cognitive and speech. Causes of autism. So this is the most asked question by parents. What causes this? And we're not sure. As you all know, the puzzle piece, it's a puzzle. The puzzle piece is the logo for autism. But research does indicate that it's likely a combination of both genetics and environment. And on Autism Society of America, as well as autismspeaks.org, two excellent websites and organizations, they have said, and they're actively researching and keeping up with the research on autism. And we do know this, that there's no one cause of autism. Over the last 5 years, scientists have identified, and this is encouraging, a number of rare gene changes or mutations associated with autism. Specifically, researchers have identified 100 autism risk genes. That's pretty amazing. But even with that, it only accounts for 15 to 20% of the cases. So most cases do involve a complex and variable combination of genetic risk as well as environmental factors that influence early brain development. Now, research does point to some environmental factors, and again, this does not describe everyone on spectrum, and just because someone might experience these environmental factors does not mean they're necessarily autistic, but research does point to some of these factors. There are 5. One is advanced parental age. Both the mom and the dad can be a risk factor. Maternal illness during pregnancy, and then prematurity, extreme prematurity. Most preemies are not autistic, but extreme prematurity might be a risk factor, as well as very low birth weight. And then mothers exposed to high levels of pesticides and air pollution. That can sometimes lead to having a child with autism. And there is a small body of growing research that shows prenatal vitamins can have, women that use prenatal vitamins or take prenatal vitamins will have a lower risk of having an autistic birth. Yeah. All right. So we're going to camp out on this slide for a little bit of time looking at the symptom categories. So remember the social, emotional, and then restricted and repetitive, restrictive interests or repeated repetition. So we see here, I'm going to use this case of, let's say, Timmy. And Timmy has lined up his ducks. So he has his ducks in a row. And he has to do this. He has to put all of his ducks in a row before he can nap. So he, at this age, 3, he has a restricted interest in collecting duckies. And then the repetition or need for sameness, lining things up. He lines them up before he'll go down for his nap. And mom and dad learned that they need to let him line up his ducks, because if they interrupt him, then a meltdown might occur. Yeah, ducks in a row. So he does have difficulty with transitions or when interrupted, when he's doing something that he prefers or enjoys doing, and some sensory sensitivities. Then on the social emotional side, eye contact, while he can make eye contact, sometimes mom and dad need to remind him many times to make eye contact. And it's limited when he does choose to make eye contact on his own. Difficult expressing emotions, and his parents and others can't always read what he's feeling, because his face might be quite blank, and he might be actually on the inside frustrated, irritated, or even happy. So, and we do help Timmy eventually with some ABA therapy learn how to express his emotions with words so those around him can know what he's feeling. And then difficulty combining the body language and gestures with his speech. So it might be kind of robotic as he talks. And difficulties developing and maintaining friendships. At this age, side-by-side play is pretty common anyway, but even as he gets older, it's difficult for him to engage someone else unless that person is interested in talking about what he wants to talk about. At this age, duckies, later Pokemon, eventually Legos. He can talk about that really with quite a bit of flair and knowledge, but yet if the other person wants to talk about something else, it's very difficult for him to switch from talking about his Legos and everything related to Legos to what they want to talk about. So those are the symptom categories. We'll be referring to that again throughout the presentation. So let's talk about the 3 levels of autism, and I want to talk about level 1 first. This is also called high-functioning autism, and typically those that were diagnosed with Asperger's disorder, this would be where they fall, sometimes level 2, but typically under level 1 autism. And not everyone with level 1 autism would qualify for having Asperger's either, but many times that's where folks that were previous to the DSM-5 categorized as Asperger's typically are here, or perhaps social communication disorder, and sometimes even like an atypical ADHD. So not all Asperger's people fall here, but many do. So with the high-functioning autism, and see our picture there of Einstein, those that have looked back over biographies done on Einstein theorize that perhaps he had Asperger's syndrome. So the social symptoms for the high-functioning autistic individuals would be difficulty with social interactions. They could be kind of awkward, missing social cues sometimes. Sometimes the eye contact is different than what you would say a neurotypical person would be. Sometimes difficulty with humor and understanding it, as well as understanding metaphors. Raining cats and dogs, what do you mean? I really don't. And then restrictive and repetitive behaviors. This would be the obsessive behaviors and routines, such as we looked at with Timmy when he was a little older than where we saw him there at 3. He was very interested in everything Lego, everything dinosaurs. And those restrictive interests can kind of change over time, but typically they'll camp out on a particular interest, like Einstein. And then sometimes also the routines, obsessive routines, and following of rules. Typically people with this high-functioning autism, they're very good at following rules. And so if they're taught the social rule, which is what we help them with, those of us that do therapy with people with Asperger's disorder, we teach the social rules and help parents teach that, ABA therapists within the home, any school counselor and teachers. They're learning the social rules because those social rules don't come naturally to them. They have to be taught, and then when they are taught that, they can follow the rules. Yeah, Big Bang.
What would be right in this situation?
Big Bang Theory, yeah, the Sheldon character and how his friends teach him, particularly Penny seems to teach him quite a bit, the social rules, and then he follows those. So that is high-functioning autism. It has the best prognosis of the 3 different levels for treatment. And also, speaking of high-functioning autism, 10% of those diagnosed with autism will eventually lose the diagnosis. That's with treatment. And early intervention is key, very key. That's why getting that full assessment as early as possible, and then the various pieces at school, speech therapy, occupational therapy, ABA therapy, it is possible that we see people losing the diagnosis, but just 10%. Yeah, that is still good. Absolutely. There's.
Brandon or John Robson, whatever his name is, would they be autistic? They're autistic, kind of Brandon?
Oh, I'm not sure. Yeah. Yeah. So, some distinctive strengths of people with autism, particularly high-functioning autism and Asperger's, they have this uncanny ability, or can have, again, if you know one person with Asperger's, you only know one person with Asperger's. So some people might have these gifts and some may not. But we do see this giftedness, so to speak, with ability to understand concrete concepts, rules, and sequences. And sometimes seeing sequences before, say, someone their own age in school that is neurotypical would see the sequence. Strong long-term memory skills. So sometimes we do see working memory, and we assess for that when we do our assessments at Genesis. We look at the working memory. Sometimes the working memory for people on spectrum, well, we just need to look into it because there does seem to be a correlation sometimes with working memory issues. But some have a very strong long-term memory. And math skills, sometimes some giftedness with math, as well as some have musical and artistic abilities that are just incredible. I remember one client that just taught himself how to play the violin. He could play for hours. Ability to think in a visual way, more so maybe than the next child, same age, that is neurotypical. Ability to decode a written language at an early age, sometimes before they comprehend it. That's called hyperplexia. Honesty, hyperfocus, excellent sense of direction. The hyperfocus can sometimes be confusing for parents when they first, for parents maybe that have not discovered yet that their child has Asperger's or high-functioning autism. So I know some of you that work with kids have heard this from parents, but the parents come in and say, but he's so bright. He can just focus on Legos. I'm really picking on Legos. He could build anything. He can just see it and then build it. He is so gifted. So I'm not sure if anything is wrong with him. But see, people that have high-functioning autism can have these just unusual gifts. Some people say savant with certain subjects. Might be math, might be physics, for instance, with Einstein. So I often tell parents, and particularly when giving the diagnosis after the full assessment's done and we see, okay, the findings show your child is on spectrum, that the autistic brain is also a gifted brain. They think outside the box. So we need to learn to appreciate that. Let's get the assessment and treatment so then your child and those around him or her can access that giftedness and you can really see them thrive. Because before assessment and treatment, it can really, really morph into, or sometimes, not all the time, but sometimes morph into other issues such as social anxiety, sometimes depression. I met with someone who is 52 years old and on spectrum, and his mom knew this, but they've had difficulty getting him diagnosed until he came and we were able to diagnose autism. And just hearing the grief throughout his life, how difficult it was. So around 52 years old now, let's say, think about the school systems, and he went to public school. It did graduate, but it was difficult, and Mom had to be there very often, helping and accommodating. Thankfully, he had some teachers along the way that accommodated, and this was before the era of IEPs, but they were able to give some special accommodations. And then college, he was able to take some computer classes, but then around early 20s became suicidal because he was told that he actually was psychotic and that the psychosis would not go away. And so he took that literally from the doctor that, okay, I'm stuck with this for the rest of my life, and so was hospitalized. So, and then we go on with the other areas of loss and grieving and not fitting in. So I'm just so grateful today for all of you being here and the work you do, and that we have better assessment, better treatment now for these individuals. Because I think this man, if he could have had early intervention like we can give our kids now at 2, 3, 4, 5, 6, 7 years old with ABA, occupational therapy, etc., who knows if he would really have as many signs of autism as he has today.
But in many ways, he had a really great outcome because he had people advocating for him.
That's true, yeah.
Because
Had
in
people
other
advocating.
cases, he would end up in much worse circumstances.
Mm-hmm.
So, yes, there's a lot of grief.
Then let's look at what level 2 autism looks like. Basically, the symptoms, the categories are the same, but a little more extreme. And for level 2, the repetitive behaviors are obvious now to a casual observer. So you can see, when you see these people in public or in the mall, for instance, with the little boy that had the meltdown. I don't know what level he is, but it could have been level 2. They have difficulty, extreme difficulty with change. So one level 2 client that I've seen, and I am disguising these cases somewhat, but before he could come and see me for the assessment, he had just opened a kid's magazine, and he had to turn each page all the way to the end before he could and Dad said, just let him do it. Just we'll just be a little bit late for the assessment, but it'll be better if he can touch each page and turn it until the very end. So he definitely has issues with change and transition. And then the social symptoms, limited initiation of social interactions. So whereas the Asperger's kids typically will try to relate, particularly when those middle school years, when they have the same social desires as the next kid. However, the level 2 kids may or may not. They might be the loners and feel more comfortable just being alone. And they have more difficulty talking about something someone else wants to talk about. They really would rather just talk about their interest, their restrictive interest. And then level 3, this is the most profound level of autism. And when you see these individuals, you could kind of tell. Definitely you can tell something is wrong. They have autism. The social symptoms, minimal responses. Many times they're nonverbal. So typically when we talk about autism and those that are nonverbal, it falls under level 3. And they're unable to live independently. They will need care, some form of care and help for the rest of their lives. So that is level 3 of autism. And I do think, I talked about 20 years ago, the level 2 and level 3 kids, I think we were identifying them maybe 20 years ago, but it's the level 1 that can be tricky, even now, for assessment. That's why I'm so grateful for the ADOS and other wonderful assessments that we have today, as well as just the knowledge of what to look for with those level 1 individuals. Yes?
Would the level 3 be mistakenly diagnosed as profoundly mentally retarded if they don't communicate?
Yes. Yeah.
So they just get institutionalized, or what would be, how do they end up?
Sometimes, or they get their parent, it becomes their caretaker. And by the way, if a child or an adult, well, I'll talk about children, if they have both autism and intellectual disability, and I know we have CSB folks here, so you can correct me on this if I'm wrong, but I've heard this from other parents. If they have both of those diagnoses, then they're more likely to be a little higher or at least prioritized on the Medicaid waiver list. So those are monies set aside to help families who have either a child with autism or a child with intellectual disability. And again, why it's so important to get that assessment and that diagnosis signed off on by a psychologist or psychiatrist or developmental pediatrician, so that then we can resource families with this knowledge. So some general interventions, of course, assessment. We'll talk more about ADOS too. I'll go into some details about that in the second hour. And assessment, of course, I'm a testing psychologist and autism advocate, so we have several testing psychologists at Genesis, and we do best in class, you would say, autism assessment. Also at EVMS, they have a neuropsychologist that does autism assessment with the ADOS, and long wait list there. And then, well, I just remember before, some years ago, and this is before Genesis before we invested in the ADOS and other assessments for autism, I remember families driving up to Baltimore to have their kids tested. Do you guys remember that? Like, it's about 10 years ago. So I'm glad now there's several of us in the community that can provide this assessment. ABA therapy. So ABA stands for Applied Behavior Analysis. And there are several groups in town that provide that. Family Priority. Do we have anybody from Family Priority here with us today? No. I make a lot of referrals to them, and it's my understanding. Well, I met the director there some years ago, and she said, I'm going to keep bringing ABA therapists to town. They do have a wait list right now, but I encourage parents, hey, get on the wait list. Your child, if your child has autism, they need, particularly level 1 and level 2, they need ABA therapy. Yes, I'll explain what ABA therapy is. So it's derived from behavior analysis, and this was originally described by B.F. Skinner in the 30s. He didn't invent ABA, though. That was invented later, but they used some of the same learning principles as behavioral analysis. Behavioral analysis focuses on principles that explain how learning takes place. So since the 1960s, we've been using this. Our school systems have used it. Of course, with cognitive behavioral therapy, the behavioral therapy part there, we've been using basically some of the principles of behavioral analysis. So ABA is a specific set of skills, and it's called applied behavior analysis, and research shows it is effective. And if you look at the whole body of research out there regarding what's helpful for people that have autism, you'll see ABA is really the number one. Now, there are some other approaches and therapies. We'll talk about them the second hour because they're not as prevalent, but they are out there and have been shown effective to help people on spectrum. But ABA would be the granddaddy therapy for helping those with autism, level 1, level 2. And ABA basically targets the learning of skills for the child and the reduction of challenging behaviors. And there's some different forms of ABA, but in its strictest form, the ABA therapist will work with the child a few hours, several times a week, and they actually target a behavior and work towards changing that behavior. Teach the child the rule that would help with that behavior. For instance, eye contact. They teach eye contact. And some children that have been through ABA therapy, they will kind of count in seconds, 1, 2, 3, eye contact, 1, 2, 3, and make eye contact again. So they do that until the child learns to make eye contact. The ABA therapist will start their therapy with the most prevalent and most difficult of behaviors. So if meltdowns are part of a child, what the child is struggling with, and many times they are, that's where they'll start. Or if the child is combative, and not all autistic people, most are not combative, but some are. For those that that needs to be the first behavior that's worked on and targeted. And they'll graph, literally, on a sheet of paper, the change over time. That's the strictest form of ABA, and that form, the ABA therapist will be either in the home or you'll go to the ABA therapist's office for up to 25 to 30 hours per week while they're starting ABA to help this child with their behaviors. And early interventions.
Medicaid funded service, so if you don't have Medicaid, usually you can't get it.
It is, but autismspeaks.org has a list, it's a 3-page list of different agencies in our area, and a parent came in recently that has Aetna insurance, and she found an agency in that list that does take Aetna, and some of them take TRICARE. Family Insight is trying to get paneled with, well, they take TRICARE and all the Medicaid products, but they're starting to take others. Yeah, but you're right. For the longest time, I would have to tell parents, if you want an ABA therapist, you're going to pay out of pocket unless your child has Medicaid insurance. So, but that good news there, the children with Medicaid are served well with ABA therapy and some of the other in-home products. So ABA, there's BCBA, that stands for Board Certified Behavior Analyst, and they actually have the certification, and typically with agencies that provide ABA therapy, there's at least one board certified behavior analyst, because they are the ones that have to write the treatment, but then it can be implemented by a trainer who's not board certified, but ABA trained. So, and ABA sessions, again, are typically 2 to 3 hours long. They break after each hour briefly for some free time and play, and can be up to 40 hours a week of therapy. Then recreational therapy is also very helpful for these kiddos, and particularly when they're that age that social relationships become even more important, 9, 10, 11, prepubescent, and also for the teenagers with autism. Recreational therapy can be done in groups and can be their socialization. Occupational therapy, and this is particularly if the child also has some issues with motor skills, gross motor skills or fine motor skills. And you'll see that with some of the kids on spectrum. They're just a little more clumsy, that might have some odd gait, or particularly if they have the repetitive movements. Occupational therapy is wonderful for treating that. And early intervention is key for this. I mean, it can be applied whenever they get the diagnosis, but again, early intervention, I've seen behaviors, quite severe behaviors in 3 or 4 year olds that after a year of occupational therapy, it's taken care of. Special accommodations in school. Thank you to all those here, Dr. Lee and others who help these kiddos in our schools. And special accommodations are so important. And the special accommodations, I often tell families, if you go online, you'll find dozens of special accommodations. Do not ask the school to do all those special accommodations. Think about the top 3 that would help your child, and go to the child's study with at your child's school. That will be with typically the school psychologist or school counselor, associate principal or assistant principal, and the child's primary teacher, and then work on the special accommodations that would be most helpful for your child at that time. And of course, those special accommodations can change as your child's needs change. Social skills training groups. Excellent. And at Genesis, we provide this for kids 6 to 9 years old. We call it our Junior Kids Club. And then our Kids Club groups. The one in Hampton runs all the time. We're going to be launching one in the fall for the kids 9 to 12 years old here in Williamsburg. And yes, insurance covers that, and we take all insurances. So social skills training, we call it Kids Club, so the kids think they're coming to club. They get to meet their friends there at the club. It's an open group because we learned through the years you can't really require that children and their parents show up every week, but we use a curriculum called Mind Up curriculum. Anybody use that? The Hahn Foundation, as in Goldie Hawn, has invested in this Mind Up curriculum, and it's used in school systems as well to teach social skills, resilience, brain appreciation. We look at the findings there in brain science, and that's applied even with these kiddos, and anger management, emotional regulation. But for them, it's fun. We're switching up the activities every 5 minutes and teaching these skills. We've been running that group in Hampton for more than a decade, actually. So, and any other groups in the area that run social skills groups? I think Family Living used to. I'm not sure if they still do, but yes. Yeah, that one's going on now, every Thursday at 4:15. And it's an open group, so if they're on vacation 1 week, no problem. They can join at any time. And if they have to miss a week or two for soccer practice, that's okay. They can come right back in. And we're taking sign-ups now for launching that in our Williamsburg practice. So at this point, we're about to take a break. Before we do, I want to take a few questions. And please note that I will be talking more about assessment. So if your question is about assessment, it'll probably be answered in that second hour. Yes?
What are some of the common special accommodations in the schools?
Yeah, special accommodations, the common ones in the schools. And those of you that are school counselors, please pipe in here, but I'll give some that have helped the kids that I know. Sometimes like a free pass if the child is becoming overstimulated, let's say the 5th grader is feeling overstimulated by something going on in the classroom, maybe with his peers or a video that's playing, that he has a free pass to go straight to the school counselor, or if there's a teacher's aide, he can go straight to her desk and sit with her. That's a common one for the kids that really struggle with being overstimulated. Of course, the child study will determine whether the child is going to be mainstreamed in the regular classroom and just have special accommodations versus a small contained classroom in special ed. So free hall pass, definitely the teacher knowing about the diagnosis, preferential seating, usually close to the front, where he or she is less likely to be overstimulated by what's going on in the back with the kids passing notes and so on. The other special accommodations we commonly see for... Oh yes, test-taking accommodations.
Movement breaks, comfort animals, weighted blankets, weighted pillows.
Yeah, a fidget toy, yeah, that they can have in their hand. Yeah, and for thank you for the...
Cafeteria tends to be incredibly overstimulating for a lot of kids, so being able to wear earplugs or ask for specialized seating in the cafeteria or gym, sometimes gym.
Yeah, in the classroom. The test taking, very important, because if they have test anxiety, we can have a special accommodation of time and a half for test, or the test being taken in a one-on-one situation, say within the school counselor's office. Other helpful school accommodations that we commonly see. Those would be the big ones, yeah. All right. Okay, so we're going to take a break, and there's some snacks, 5-minute break. Thanks, everybody, for gathering for what will be a riveting discussion of the ADOS-2. I'm partially kidding. It is very interesting to me as a testing psychologist. So we need assessment. One reason why is because there are these comorbid concerns sometimes. I could add up there also disruptive mood dysregulation disorder. Sometimes the children, might have that versus autism, or maybe ADHD or disruptive mood dysregulation disorder, social anxiety. ADHD has been diagnosed, but it just still doesn't quite explain everything the child is struggling with or adult is struggling with, like in the case of the 52-year-old male misdiagnosed as having schizophrenia. So assessment is so important. And for assessment, we're also ruling out these issues, or seeing if maybe one of these issues or DMDD, psychosis might make more sense. So assessment. There are two types of assessment out there commonly used. One is the Autism Diagnostic Observation Schedule. This is we observe the child with different tasks that we're encouraging the child or adult to do over the course of 45 to 55 minutes. And then, of course, checklists. A lot of checklists here, and many of them are measuring the same thing. So you don't need to give the client or the client's parent all of these checklists. But these are some of the great ones out there. I don't have it listed there, but I also want to make you aware of one that is public domain. And this, again, Tony Atwood wrote this, the Australian Scale for Asperger's Syndrome. You can pull this up right online, and it's excellent to use during a session if you think, say, you're doing couples therapy, and wife thinks husband might have Asperger's. You can pull this up and interview him and her with this Australian scale, and it really is a good interview format, pretty thorough. And then some other ones and there's a cost to these. Pearson, actually, you can buy the Autism Spectrum Rating Scales from Pearson. That only goes up to age 18, but down to 2 years old, which is great. Or a sensory profile, and that looks more at sensory processing disorder. Again, not in the DSM-5, but something that is, it seems to be 1 out of 20 individuals have sensory processing issues, and those on spectrum certainly do, autism spectrum. At Genesis, we use a lot of these, the Childhood Autism Rating Scale. I like it because the parents, it gives kind of self-awareness for the parents and some psychoeducation on what to look for, and it looks at what the child may have struggled with even early on, 2, 3 years old, or even from birth, if they were meeting their developmental milestones on time, to current, and allows the parent to rate things, but also to write in some examples of, say, restricted interests that they've found for their child. The Gilliam is very similar to Childhood Autism Rating Scale and the ASRS. Autism Diagnostic Interview, that goes up to 43 years old, so that's helpful to have for some of your adults. Social Communication Questionnaire, we also use this a lot at Genesis to try to rule out maybe this is social communication disorder versus autism. Big difference there would be with autism, you have to have, again, the restrictive interest or repetitive movements or need for repetition, whereas social communication disorder doesn't have that key sign. So now the ADOS. Let's talk about the ADOS. Do we have any others that use the ADOS-2? Okay. Yeah, so at Genesis, there are several of us. All of our testing psychologists use this Autism Diagnostic Observation Schedule as an anchor test, I often tell parents, within the whole battery. So we don't just give the ADOS and then make a diagnosis. And actually, the creators of the ADOS say, don't just use the ADOS and make a diagnosis. Definitely you need to do the interview, you need some other checklists, and then an overall personality assessment to see if maybe, or psychological assessment, to see if something else is going on. So we use the BASC ratings for parents. That would be a way to look at various behaviors of different diagnoses as well, to rule those out. And then usually projective testing for the kiddos and adults, as well as when they get to a certain age where they can answer effectively questions about their emotions. We will give usually the Beck Youth Inventories or the MMPI, or Mackey is the MMPI for teenagers. So, but this is the anchor test, and the gold standard one you'll see throughout the literature for measuring the symptoms of autism, and it's wonderful. The norms, it's standardized, so we have norms, and we actually at the end of the assessment and after scoring it, we'll have a score to see if the symptoms are mild, moderate, severe, or if they're not autistic. It is semi-structured, and we are looking at communication, social interactions, imaginative use of materials or imagination, and again, the restricted repetitive behaviors. The restricted interests don't always show up there, and that's why the interview is so important, because what the ADOS is to the child, it looks like I'm playing with Mr. Potato Head for a couple minutes. I'm doing some storytelling with my therapist for a few minutes. I'm looking at cards with facial expressions for a few minutes. So basically, they think they're playing, but it's structured play. What we're really doing, a few of these tasks, for instance, we're looking at eye contact, and while we're giving the ADOS, we're counting the number of times that child is making eye contact with that one task. There are a few tasks where we look at eye contact. There are other tasks that we're looking at how creative or imaginative the child is. There are some tasks where we're looking at if the child has a sense for social understanding, and specifically what their social role is when they're describing how friends relate. And so if it's a 10-year-old, we look at, we have the norms for how most other 10-year-olds that aren't on spectrum would score on that versus those that are neuroatypical or have autism. More about the ADOS. It has 5 different modules, so we can test from 12 months old, that's the toddler module, all the way up to adults, older adolescents and adults. Module 4, they're not playing with Mr. Potato Head at that point. We have other tasks that the adolescents and adults do on the ADOS. So here's the ADOS kit, and we have a large sign on our kit, our ADOS kit. This is not a toy box. Please don't use this for your play therapy. These toys all have to be in there so that we can get the kids through the modules that are, again, standardized. It's 40 to 60 minutes. And they're asked to complete a variety of tasks. Again, like there's some storytelling, and that's at all ages, although the adult and adolescent stories are more age appropriate for them. Imaginative play, and the reciprocal social interactions. Some of the tasks are designed so that it would prompt the child to say, oh, so what are you thinking with your story? Or as we're playing this, what do you think? So, and children that aren't on spectrum will typically engage the examiner like that. But it's amazing that the children on spectrum might not engage the examiner in what she's feeling.
It'd be interesting to see a video of a test with a child
Yes.
who is
on the spectrum, maybe compared to one that's not.
Yes.
Just some differences
And-
in clips would be fascinating.
Yeah, YouTube has some clips. They have one of an adult taking it, but I get a sense that it's one graduate student testing the other. No, and that we do practice that way in order to learn these tests. I often tell my clients, we have dozens and dozens of tests. I've taken all of them myself. When we get a new one, I like to take it myself or somebody administer to me. So I can just kind of relate to my clients, and also it helps normalize it so they're not as fearful. So all the tasks were adjusted for age, developmental level, and language abilities. And again, we do have a module for those that are less verbal or nonverbal. It is more difficult to test them, but we can. So that is the ADOS-2. And I know, even though it's normed down to 12 months old, I would say most testing psychologists really prefer to test, if we can, older than 24 months, because as you all know, the behaviors can change and sometimes morph, particularly around 18 months or so. They grow out of certain behaviors. The beauty of the ADOS is, unlike intelligence tests, which we can only give once every 12 months, the ADOS you can give every 3 to 6 months. And the ABA therapists love it because our write-up shows all of the symptoms and signs of autism that we see in the ADOS and the symptoms and signs that we don't see. So then the ABA therapist knows, okay, these are not an issue, these are. This is what I'm going to target with my ABA therapy. I think I had a question.
As you mentioned language abilities, it occurs to me to ask, are they available in other languages besides English? And are they culturally adjusted?
Some of the checklists are. I do not believe the ADOS is. That's a great question. You know, is it available in Spanish? I'm not sure. Yeah. But if you have a client that you're thinking about, I'll go look that up in the manual. I don't think they have it, though, for other languages. But the checklists, certainly, some of those checklists, Pearson has readily available in Spanish. Yeah, and the Basque, we have the Basque in Spanish as well for your Spanish-speaking parents. Because we do get those referrals quite a bit, where the parent's primary language is Spanish, but the children are bilingual. So the Basque is an inventory for the parent to fill out with a variety of issues and psychological problems on the child. Yeah. Okay. More details about the ADOS. We're almost done with the ADOS. There are 3 categories of scores that make up this final comparison score, and that's where we'll see if the child is on spectrum, if they're not, or if they have certain symptoms, but not enough to be on spectrum. And again, we're looking at language and communication throughout the test. There are certain tasks where that's what we're looking at: conversational skills, use of gestures, if the gestures and the facial expressions match what they're really feeling. Reciprocal social interaction, like I said before, if there are certain tasks they're designed to have the child ask and interact with play. And again, the stereotype behaviors and restricted interests. The ADOS is only 60 minutes. Of course, we're going to be with the child more like 2 to 4 hours, depending on how much testing, if they need intelligence testing or not. So sometimes we really pick up on the stereotype behaviors within the broader time we're with them. And we have the hour-long interview or 45-minute interview even before the testing. And I like asking parents about the restrictive interests, because related to restrictive interest would be collections. If the child really is an avid collector of something, one child, shiny rocks, been collecting shiny, and will take one to school in their pocket, and they need that. They're attached to the shiny rocks. So, you know, there are some things that might represent restricted interests that are not as obvious as Pokemon, Legos, and screen time. Screen time's a huge one, as we all know. And we see that more with kids on spectrum. We see it with kids of all ages, but the spectrum kids can get very attached to their screen time. There's also additional scoring where we look at imagination, agitation, disruptive behaviors, and then anxiety, because social anxiety can be one of those comorbid concerns. Okay, a friend of mine who's a recreational therapist put together this slide on understanding behaviors. So when we're working with these kids in school, in groups, at our churches, in youth groups or Sunday school, as well as just in therapy, as you're helping the parents understand behaviors, it's good to always keep in mind and to also coach the parents. There's always a reason for a behavior. So the meltdown the little boy had in the video is a reason for that. He was overstimulated. Sounds, smells, the lights, and also all behavior is some form of communication. And that gets a little trickier with kids on spectrum. Again, particularly if what is showing on their face is not what they're feeling on the inside and they're feeling misunderstood. So support and understanding are very helpful for figuring out what these behaviors are. And things that contribute, and also some accommodations that you want to give children. Sometimes they need to avoid a person or a place because it could trigger them. Of course, hunger, fatigue, physical needs. I know many of the children on spectrum, the parents have a routine structure for when they eat, and they really try not to vary that too much. Because if it does vary, the child, difficulty with transition, and sometimes they even have sensitive systems, digestive systems, and so on. So structure is very important, and diet. Also, the need for completing a task, like the boy that couldn't come back, or he would have had a meltdown if we would have interrupted his turning of the pages of the child's book. And side effects to medication. Again, I just see this correlation with the sensitive system. So, where, say, a mood stabilizer might help with the meltdowns, but then they have an allergic reaction to that or a negative side effect. So medication with people on spectrum can be tricky. So it's important for us and parents to be aware of what happened just before a behavior takes place, so that we can help make some accommodations for that. And this sensory processing disorder, their sensory overload is, and these are some common ones, the excessive light or in a crowd, being in a crowd, excessive noise, but, and there are others as well, like tactile. It's very sensitive to certain textures, and some of my clients, they only wear one pair of sweatpants or will refuse to wear pants, will only wear shorts. So one autistic female, so that became tricky when it snows. Yeah. So a quote here, when a flower doesn't bloom, you fix the environment in which it grows, not the flower. Of course, we're going to assist that child with coping and relaxation strategies and therapy, but we also can help the parents look at the environment. And in the school systems, they are helping with the environment and the special accommodations, or maybe even small contained classroom. So in responding, it's very important to be calm with these kiddos, even when they start with the stimming, we call it, being overstimulated, looking like they're in the midst of a meltdown. Really, it's them being overstimulated, like the boy in the video. Didn't the mom do a great job? She remained calm through that. You change the setting, but ask permission first. So that can help them transition, but we typically want to ask the child to help prepare them mentally, since transitions are certainly difficult many times.
Can I ask about that? So change the setting. I'm picturing mom leaving the dog, but you don't have to ask the child, do you want to leave? You'd say, come on, let's
go where it's quieter, or?
Yeah, in that case, I'm not sure how she handled that, but I think.
What situation are you talking about where you want to
Yeah,
ask them?
well, that would be a situation. Like if you are in Walmart with all the sounds, and so why don't we go sit in the car for a little while? What do you think of that? And then kind of encourage it. And certainly if you're doing group counseling or in the classroom, okay, let's finish up our computer time in the next 5 minutes, and then we're going to switch to math, prepping the students and offering choices when you can. I know that's not always possible in the classroom. Praising the positive, this is very important. And sometimes these kids look like, again, that praise is not affecting them, but it is. They're hearing it. And just like the next kid, they eat that up. Consistency is so important, the 5 to 10 minute transitions warning, and redirecting. And the redirecting, so the counting, like we saw in the video, is a type of redirection. And avoiding surprises as much as we can. I know surprises come with life, but if you can avoid them, it's a good idea. More with just practical information about groups, and this again in school as well as group counseling. It's really important to avoid responding particularly to enacting out behavior publicly. These kids have grown up, and adults have grown up feeling misunderstood. They think outside the box, and they really sometimes many times have difficulty fitting in. So there is that self-consciousness there. It's very important to not point out things in a group, if at all possible.
It's painfully obvious to them that they do not fit in.
Yeah, many times. Yeah, it is painfully obvious to them, thank you, that they don't fit in. Open communications within a group when possible. And of course, we are the advocates for each of these children. So I want to talk about some therapies. ABA, of course, we've already talked about that, and that is the gold standard. But there are some other ones that are coming out. Yale is they're doing a study on pivotal response training. This can be done in the naturalistic environment, in other words, by the parents at home and at the park, etc. Parents can be trained in this one. Parents can also be trained with some of the skills from ABA to reinforce with the child. And then Valerie Gauss has written this book for adults on spectrum, and it's cognitive behavior therapy for adults. So those of you that treat adults on spectrum, it's a nice book. And the couples workbook by Tony Atwood. Dr. Atwood has done quite a bit of research. And we do have some other therapies too. One that it can be an extension of ABA is called verbal behavior therapy. I don't know of anyone doing that around here. Please shout out if you do these types of therapy with your autistic clients. I want to talk a little bit about pivotal response training. It is derived from ABA. It's play-based and child-initiated and can be done, like I said, in the natural environment. It's a lifestyle that the affected family has to adopt. It becomes a lifestyle for the families. Then the Early Start Denver model, it's a validated comprehensive early intervention. So the Denver model, Early Start Denver model for the preschoolers has been shown to be effective. Teach, T-E-A-C-C-H, autism program. This is coming out of UNC, Chapel Hill. They're doing research on it, and it looks promising. I just want to tell you all some of the developments and trends. We'll see if these stick over time like ABA has. And then CERTS, S-C-E-R-T-S, that stands for Social Communication, Emotional Regulation, Transactional Supports, and it's particularly provided in school settings. And I don't know of local schools that provide CERTS, but it does look promising and has been validated. Okay. So we understand that there's a purpose behind the autistic person's behavior, so it's important for us to find out what that is so we can accurately respond to what they're saying. Some other treatments, and this comes from EVMS, So these are adjunctive therapies, if you will, that are really helpful to add on to ABA. I often tell parents there's nothing that can replace outpatient therapy and ABA therapy, not that they have to go forever, but it's very important, particularly after a diagnosis. For outpatient therapy, the goal there is to help this family and this child incorporate this diagnosis in the most productive way into their life story and family story. So ABA therapists don't really do that. They have their own specialties, which we know it's targeting the behaviors. So I think an ideal treatment plan therapeutically is when you have a therapist that can help this family connect to resources and help them, again, incorporate this into their life story in a productive way, as well as help with the anxiety that the parents will feel upon hearing their child has this diagnosis. They feel anxiety, sadness, and also relief. So it's helping the parents, also helping the child. At Genesis, sometimes we'll have one person helping the parents and the child seeing someone for play therapy. Although all of our therapists that see children also do parent consultations, sometimes before, at the beginning and end, or one or the other of the session with the child, just to make sure the parents know what we're targeting. Yes, sir?
Yes. I was thinking about some of the pop cultural representations of the spectrum, and I think about, as has already been mentioned, Jim Parsons' brilliant portrayal of Sheldon on Big Bang Theory as an Asperger's guy. But also Claire Danes a few years ago Claire Danes a few years ago did a wonderful, I thought, representation of Temple Grandin in that TV movie, Temple Grandin.
Yes.
So just wondering if there are TV movies or TV shows that the clients and parents can look at, people who are doing well, learning, growing. If you think it's some accurate representations that might help instill hope.
Yeah.
Do you believe those two are good models? And if so, great, or not, why not? And also the other examples in the pop culture that I could recommend to clients and their parents.
Sure. The Temple Grandin story with Claire Danes, definitely excellent. Also, there's some other example videos, etc., on Autism Speaks, as well as the Autism Society of America. There's one called Autism in Love, but I would definitely say parents and adults with autism to watch that one, because
Kids are having some too. The Blue Power Ranger, the brand new Power Ranger movie that came out, the Blue Ranger's autistic.
Oh.
So they are doing
Okay.
things at a younger age
Yeah.
now to try to show that, kids okay.
Sesame
It's
Street
okay.
has an autism
And-
Yes.
puppet now. Sesame Street has a preschool autism puppet.
Yeah. The Sesame Street Julia, she has autism. Yeah, so there are examples of this, and as we'll have some time in just a few minutes to share resources, so we can talk more about helpful use of video to bring awareness. So I know we've talked about speech therapy, occupational therapy already, the social skills group, medication management, again, that can be tricky, and neurofeedback. Actually, all of these come from EVMS. I added neurofeedback in educational therapy. Neurofeedback is something we provide out of our Hampton office, but Terry Troyer, LPC, here in Williamsburg, provides it at his practice. And it's basically biofeedback for the brain. More about that on our website.
Do you have any hope for the magnetic, what's it called?
Transcranial
Yes,
magnetic.
thank you. Do you have any hope for that?
Yeah, oh, definitely for treatment of depression. I don't know what the research shows with autism, though, with that. Yeah. So, unless somebody like you cares a whole awful lot, nothing's going to get better. It's just not. This is my last slide, and here you have, and I hope you can see it. I know it's printed real small on your handouts, but some excellent resources. And our GenesisCounselingCenter.com autism page is up there as well. And we are adding to that in a couple months when we revamp our website. Our regional manager is very excited about this. But the information on there is great, and it's written by Dr. Cindy Kokoris, one of our child therapists and psychologists who do testing. So we have the rest of the time for questions and sharing of resources. So, yes.
I have a question. So I have a child who has autism, and he's very sensitive to his brother breathing in the back seat of the car.
Oh, yeah.
And he, at this point in his life, refuses to wear the accommodation, which was some headphones to listen to music, and he's just pretty much bullying his brother.
Okay.
His brother even gets tired of him, like he's going to fall asleep or wake him up. So I wonder then about, you know, the behaviors and how they really do start to take over some of the family relationships and functions and that sort of thing. What we might recommend.
Yeah, definitely some family therapy and individual therapy for this young man. So this child is part of his sensory issue is hearing his brother breathe. So when brother falls to sleep, he'll try to keep him awake. So it's turning into kind of a bullying situation. Yeah. So definitely some family therapy, working with maybe where they're sitting in the car and rethinking or trying to come up with something else he can wear, earplugs. Yeah. Any other questions? And this is sharing of resources too. So I'd like to hear from those of you who are treating autistic children and adults and some resources in our community.
I just had a quick question about your Chesapeake office. Is there a group for the adults?
I'm sorry?
Is there a group for the adults at the Chesapeake location?
At the Chesapeake location, we do DBT groups there. And DBT is very effective for adults that are on spectrum. It's dialectic behavior therapy. It's research proven to help with emotional regulation and boundaries in relationships and to have more successful relationships. Yeah. And our DBT groups are time limited, so we're always going to be having sign-ups for the next one. So if it's not running right now, that's okay. It will, and your client will be called when the next one launches.
I did want to share, I work for the REACH program for adult anxiety and developmental delays, which is also children REACH, which ran out of Western Tidewater, and of course adult REACH ran out of Hampton New CSB.
All right.
So we're a crisis response program 24/7. We have a crisis line number I can memorize, but I can provide that number because it's 24/7 for any clients that have intellectual disabilities and developmental delays.
That's great. And is that the crisis program that Medicaid clients can?
It's not Medicaid, it's a voluntary program, so we're not necessarily trying to build a state-funded program, so we're here to help the community.
Okay, great.
For example, if someone's in crisis, I work with emergency services a lot, and we have someone who's suspected to have an intellectual or developmental disability, we are supposed to call and consult with that program to make sure that we are getting the appropriate care for the person so that we're not hospitalizing people that don't need to be hospitalized, or if we can provide a respite or a different in-home crisis state to try to keep people out of this, the more intensive system, because we know that they don't succeed well there.
Yeah.
It's not designed for them.
Right. Yeah, and they can be overstimulated sometimes, having to go to a different environment, where if you can have the crisis counselor come in the home, from what I understand, almost every day, sometimes, they come in for crisis stabilization.
Yes, crisis stabilization is 15 days. We have a crisis therapeutic home in Hampton. Stepping down from the hospital, you can stay up to 7. If you need a preventive stay, you can stay 3 to 5 days.
Oh, okay. So
crisis response, so the REACH counselors or coordinators will come into the home.
Yeah.
Providing follow-up.
That's the program I'm familiar with. Yeah. That's excellent.
Here's
For the whole region, and then even shore.
There's a book by John Robertson. I've lost his name anyway. And he is autistic, and he wrote a book called "Look Me in the Eye" and how hard that's the way we judge people is look me in the eye, and how hard that was for him. You can see sort of the
Yeah.
And then he wrote one called Switched On, which was his experience with transmagnetic.
Oh, okay.
Yeah, so the research that was happening on that, I think it's in Boston.
Okay.
And basically it's magnetic, yeah, and it's very quick and it can have profound impact. It doesn't continue to last is the issue, but he got so much insight from being able to perceive things he'd never been able to perceive things before.
Right.
And so we learned that was like some amazing social skills training for him. But that's another guy. He's the brother of Augustin Rose, who wrote Running with Scissors, who's a famous author. And this is his other brother who traveled with rock bands and had an amazing career as a sound technician. And he's absolutely brilliant when it comes to electronics. So we're talking about success stories.
And Running with Scissors was made into a Noah Baumbach movie
Yeah.
about 10 years ago, which
Yeah,
is pretty good.
This is John Elder Robson, and he has an amazing story. It's so interesting. Robison. And he traveled with the biggest rock bands in the world, and he was their sound guru.
Yeah. His restrictive interest.
Exactly. He could hear everything.
So good at it.
Yeah.
And what's the name of the book?
Sorry.
Look me in the eye.
Look Me in the Eye was the first one. And I didn't get the history back. The other one was what did I say the other one?
Running with Scissors.
Running with Scissors is the book his brother wrote,
Ah.
which is very famous. Switched On
Switched On.
is the one he
Yeah.
wrote about his experience with transmagnetic. What is it? Can you never-
Yeah. Transmagnetic cranial stimulation.
Thank you. Yes. Yeah.
Yeah.
I lost it, but it's like Temple Grandin. It's this person who had this incredible skill, incredible intellect, but is also very autistic. Knew he was different. His life experiences, and as he's come out kind of at the end successfully.
Right.
So there's positive stories, and you get a sense of what it must be like to live in that. You know,
Right.
from
I was
that.
going to mention, John, he also is an adjunct professor at William & Mary and speaks there from time to time.
Oh, that's
Oh,
right.
my
I forgot
goodness.
about that.
Right here.
He also designed flaming guitar for Kiss, among other things.
That's right.
Yeah.
Yep.
Yeah, very interesting to hear him at the college.
Fascinating
Great.
stories,
Yes.
yes, from him.
Yeah.
So one of
Yes.
the things that can be beneficial for adults with Asperger's is to connect with other people who are also diagnosed, especially if they're, as you have illustrated, your level of funds where they're functioning, but they still struggle with anxiety, depression, keeping a job, dating,
Yeah.
negotiating the social world. I co-facilitate a support group for adults with Asperger's specifically. They like to be referred to as individuals with Asperger's.
Yes.
And it's part of a national organization called GRASP. If anybody's heard of GRASP, the Global and Regional Asperger's Syndrome Partnership, GRASP.org. And we run the Southeastern Virginia, where that particular location. So that's our group. We'll meet in March,
Yeah.
the second Tuesday of the month in March. So they like for people to go on to the grasp.org website and kind of get vetted as being someone who's diagnosed before you join the group. But you can also see me, and that's another way of joining the group because I send out the monthly emails and co-facilitate the group.
That's great. Thank you,
But
Dr.
it's so
Lee.
fun. It's not, it's not a therapy group, but it's a support group so that people can identify with others who are struggling.
Yeah. And connect and
Yeah.
friendships develop. And I do have that flyer from Dr. Lee here, and it's Ocean View, Norfolk, right? So that's not far from the tunnel, Hampton Roads Bridge Tunnel. So it's not that far of a drive for Newport News and Hampton folks.
And, a lot of the people in the group, they were diagnosed late in life, and, they share this diagnosis makes a lot of sense after a long journey of many other diagnoses, very similar to John Robison, that explains in his book, and if you talk to him, face to face, how this makes sense. So we connect with other people who have shared life experience. And where do I go from here? What does this mean?
Right. Yeah. That's great. Yeah. The other resources or questions? About ABA, and we talked about ABA before. Family Priority offers that. Family Insight, but they're based in Virginia Beach. They are actively training people on the peninsula now. And Family Preservation. Do y'all know of any other ABA groups? Yeah. Okay. All right. Well, if there are no more questions, I'll be up here at the front to field any one-on-one questions. Thank you for being here, and thank you for what you do.